In the field of peripheral nerve disorders, and mostly immune-mediated peripheral nerve disorders, it's sometimes difficult to monitor the activity of the disease. So sometimes the patients they feel weaker, but maybe the clinical examination, that is the tool that we have today to monitor disease activity, don't see any change at all. So it's the tools. So our examination is not sensitive enough sometimes. So we need biomarkers to monitor disease activity in this group of diseases. So our aim was to explore Guillain-Barré syndrome as a paradigmatic example of immune-mediated peripheral nerve disorder, because it's very aggressive, it's very acute, and it's monophasic, meaning that it occurs once, and after several weeks it stops, and the disease activity stops. So we can see the changes in disease activity from the acute phase to later in the disease. So it's a good example in order to study proteomics, in our case, or biomarkers, and then extrapolate it to other immune-mediated diseases. So that's our aim, to see if there is something in the blood of patients with Guillain-Barré syndrome that could mark disease activity and help us in monitoring Guillain-Barré and other diseases and diagnosing as well. So what we did was to analyze more than 6,000 different proteins in samples from patients of Guillain-Barré syndrome, and we had samples from the acute phase before treatment was started, when the patients were in the hospital, and then after 1 year when patients were recovering. And we compared those to see if there were differences. And also we compared those with healthy controls. As I said, we analyzed more than 6,000 different proteins, and we saw that there were some proteins that were different from the acute phase to after 1 year in the same patient, and also compared to healthy controls. And we saw that these proteins were related to inflammation and lymphocyte activation. That was something that we kind of expected, because it's an inflammatory disease or an immune-mediated disease. And also we could see that in 1 year, patients had overexpression of proteins related to nerve regeneration and axonal guidance, which also makes sense, as these patients are recovering and the nerve is growing back, or that's what we were expecting. Moreover, some of these findings, we tried to validate it with other studies, with other lab techniques, because what we used is SomaScan, which is an aptamer-based proteomic platform, but this is very limited and for research. So we needed something that we could implement in the clinical practice or in our lab. And we used two techniques, actually, mesoscale first and then ELISA, to try to validate these differences that we could see in some proteins, if we could see it also with these other techniques. And we actually did, we actually could. Like with ELISA, we could see that patients in the acute phase had higher values of, actually we were studying mostly a candidate protein called serum amyloid A1, which is a protein related to inflammation, and we saw that this protein was higher in the acute phase compared to at 1 year and compared to healthy controls, and we could detect this with ELISA, not just with the SomaScan. And we are now trying to validate this with more control population, with other neuromuscular diseases and other inflammatory diseases, because this is, as I said, an inflammatory or a protein related to inflammation. So we are not sure if it's because of the Guillain-Barré syndrome or if it's because of an infection that most of the times occurs prior to Guillain-Barré. So we need to validate this with other post-infectious diseases to see if there are differences, or we're just seeing the previous infection with this marker. But yeah, our idea is to try to validate this and other biomarkers that we have found, first in Guillain-Barré syndrome, and then try to extrapolate these findings to other immune-mediated neuropathies, mostly CIDP, and see if some of these markers could help us identify disease activity in relapses, or even if could help us to prognosticate these patients, to see the risk they have of a new relapse, or in the case of Guillain-Barré syndrome, of have a bad prognosis. But we are still doing this.